Good afternoon, everyone. Thank you, everyone, for connecting from Mexico and Latin America. Good evening if you are connected from Europe and Asia. My name is Erika Paredes, and today I will be here moderating this briefing session. So, today we are broadcasting from the UNIC. This is the headquarters in Mexico City. I would like to welcome everyone from UNOPS, the UN Office for Projects. This is a virtual session that we have already arranged. Well, this is open for the pharmaceutical market stakeholders in Mexico and worldwide. This is open for the press and all stakeholders in general. Today, we have a panel session that is going to be headed by our colleagues. We're going to be addressing public tenders, internationally speaking, specifically held by UNOPS. What are the applicable procedures for this type of health risks? Today we have Mr. Juan Ferrer Aguilar, the General Director of the Health Institute for Welfare, or INSABI. We also have next to us Dr. Alejandro Calderon Alipi. He's not on screen, but he is the National Manager of Supply and Distribution of Medication and Medical Input of INSABI. We also have Jose Alonso Novello. He is the head of the Federal Commission for the Protection Against Sanitary Risks, or COFEPRIS in Mexico, and Mr. Giuseppe Mancinelli, the Deputy Regional Director of UNOPS for Latin America and the Caribbean. We also have in this virtual session in Zoom some other representatives, directors from associations and trade chambers in Mexico, specifically for medical inputs and medication, ambassadors, diplomatic liaisons, and representatives from all countries on behalf of various international companies. At times, well, we know that in the past we used to have this meeting face to face, but because of this pandemic, we are now holding this type of virtual meetings by having these social distancing principles in place. We have 21 embassies from Denmark, the US, England, Canada, Switzerland, Italy, the European Union, Germany, Spain, Turkey, Romania, Peru, Paraguay, Panama, the Netherlands, Hungary, Egypt, Bulgaria, South Korea, Bangladesh, and we also have the great pleasure of having directors and representatives from the Mexican market. We have MELAF, ANAFAM, CANIFARMA, AMIF, LAMIR, INEFAM, AVEPRES, CAINTRA, AMEC, AMEGI, MEDEFARMA, and the Argentinian Trade Chamber, as well as the Pan American Association, PAHO. So, well, this broadcast is also being broadcasted in YouTube, in Zoom as well. This is going to be interpreted into English. I'm speaking Spanish, but we also have this broadcasting into English for your sake. I have representatives with me of the media as well from all companies that we have, all companies who have this type of interest, colleagues from the academia, and colleagues from the UN agencies. We would like to remind you all that this broadcast recording is going to be available at our YouTube channel. You are going to be able to check it out, and you can also exchange it with whoever you deem also of their interest. So we have a series of informational and briefing sessions that we're going to be hosting with the Mexican government for us to be able to clarify procedures. We're going to have open channels of communication as well for us to be able to enable this transparency. This meeting is going to have a length of 60 minutes, and it is organized as follows. First, we are going to have Mr. Ferrer talking about the INSABI UNOPS agreement for the purchase of medicines and healing input for 2020-2024. And Mr. Mancinelli is also going to be addressing how these public tenders are going to work in the international arena. And also we're going to be addressing the next steps for these tendering processes. And Dr. Novello is going to be explaining what is the procedure applicable to sanitary registries. And also, I wanted to tell you that we have received many questions from you. Thank you so much for raising your interest in getting more information on really trying to make these processes work out. A lot of these questions have been compiled already, and throughout all of these presentations, we expect to answer them all. Throughout this presentation, we would also like to invite you to send your questions to our email, licitaciones.mexico@unops.org. We will try to do whatever is in our hands for us to be able to address your questions on time. We also have a website, www.proyectosaludmexico.org, where you're going to be able to find more information on the process that we are now putting in place along with the Mexican government. And without further ado, let's begin. Mr. Ferrer, please. We have already stated ever since the end of July, we executed this agreement between the Mexican government and UNOPS through INSABI for the purchase of medicines and healing inputs. So, can you please tell us a little bit more about this agreement, how INSABI works, what is going to be the impact of all of this? Good morning. It's such an honor to be here with you. Thank you for inviting us and for having us here. It's such an honor to get your invitation. But I am pleased to tell you that we are really addressing today the pharmaceutical industry, the means of communication. So good morning. I will repeat what I said because I think my microphone was off. So I am really pleased to be here with you, with Giuseppe Mancinelli, and for being with Dr. Jose Novello. He is the head of COFEPRIS, and I have Alejandro Calderon Alipi by my side. He's the National Manager of Supply and Distribution of Medication and Medical Input in Mexico, and having also Dr. Adalberto Santaella. He is a member of INSABI. I am really pleased to be here in this session that is addressed to the pharmaceutical industry of the national market as well, and international market, and also for the purchase of this medical input in Mexico. Also, we need to communicate the responsibility and commitment of the Mexican government. And also, we know that the fourth transformation have the duty of ensuring the health rights of Mexicans, which are under the political constitution of Mexico under Section 4 of our Mexican political constitution. For that reason, this Institute for Health and Well-being was created as of January the 1st, 2020. So, one of the main pillars of INSABI is to have medications, to have the best quality input. So for us to be able to find them all for the distribution of the whole country for those in need of this input, this is in the words of our president, Andrés Manuel López Obrador, anywhere in this country, these medications are to be available. Today, at the UNOPS venue, which is part of the United Nations, we are here to inform you that this did not happen up to August 12, 2020, when we had this law of acquisitions and leasings in the public sector. Why? Because we wanted to execute and hold agreements as international bodies for us to be able to supply the Mexican state, in this case, with medication and medical input. To that date, well, at least in the past, before that day, Mexico could not really get this type of acquisitions through international agencies, but after a decision made by the President of the Republic, under the considerations and conditions that we were in, this was possible. All of the challenges that we are facing nowadays are to tackle corruption and all types of monopoly practices. For this reason, our government is trying to look for the participation of the pharmaceutical industry, both at a national level, domestically, and internationally, with a collaboration of socially responsible companies so that we can also have a more competitive market that is really living up to this historic moment in the country, up to the standards and the expectations of the Mexican population, and for us to be able to tackle all of these honest practices whenever we saw any sort of deviations and embezzlement of the funds used for medication. So for that reason, we are now allowing this medication to reach the people who are in need of these medications. So now INSABI is responsible for meeting the integrated demand of medications and medical input and of consolidating all of the procurement made by the public institutions that are part of the Mexican national health. Today, the healthcare industry is now run under Mr. Dr. Jorge Alcocer Valera. He is the Secretary of Health, and from that health department or health secretariat is now working with the Mexican Social Security Institute, the National Secretary for Defense, and many other agencies as well. And for that reason, INSABI is going to make sure that this demand is now grouped into one single system. And after that, at that point, then we can do it through UNOPS based on the actual demand of what the country needs. So now UNOPS, through this agreement, is going to be able to make the acquisition of these medications. Mexico filed this proposal, this bill, and we have executed an agreement as part of the Mexican government through INSABI with UNOPS for us to establish the procedures for the acquisition of these medications and international medical inputs, because this will allow us to make sure that the best acquisition practices are put in place with no corruption, in addition to the fact that we're going to have other types of price points from 21 countries for us to be able to find the best price points. We expect the Mexican government to make an investment of about 100 billion pesos. 100 billion pesos, which is about 4 billion USD. This is an effort that we have taken along with UNOPS, and this is how we will start defining the procurement for 2021, and that will get up to year 2024. So we would like to ensure that we have timely supply of these medications, and the Mexican government is going to develop and incorporate a development company to start developing and manufacturing this procurement. We're going to have a cold chain to have a medication distribution procedure so that we can make all of these medications available throughout the country. Thank you for your attention. Thank you so much, Mr. Ferrer. This was very interesting. So, Mr. Mancinelli, do you have any words on how these public tenders are going to be working? We know that we saw this when we executed this agreement during these public tenders. We enforced these principles of fair public management throughout this whole process. So can you please address how this is going to be working? Thank you so much, Erika. First and foremost, I would like to thank especially Mr. Juan, Mr. Novello, Cofepris as well for attending this meeting, and to all of our colleagues. We know that they are not really visible, they're not on camera because of our social distancing rules, but we have Erika and Alejandro as well here with us. Can you hear me? Okay, great, thank you. Well, I would like to greet everyone. So we have over 1,500 viewers right now. That means that we see a lot of interest specifically for this virtual event. So my duty today is for me to be able to provide you with as much information as possible. Of course, in general terms only, because we do have a lot of information, a lot of details to share with you, but this is not the last virtual event that we hold with you, but we're going to have other types of mechanisms that are going to be shared with you depending on the point in time of this process. So do not worry if we do not share all of this information with you. We're going to have other meetings for us to be able to do so as well. So we'll start with the context for us to be able to see what UNOPS means. We have a lot of awareness, we have a lot of curiosity because it's important to find what UNOPS is. This is part of the UN system, and also the General Assembly defines that UNOPS is the main resource of the UN for the management of acquisitions and agreements, and also when it comes to the development of physical infrastructure and capacity building and project management as well. So UNOPS has global reach. It is present in over 80 countries. That also allows us to have more access for the best international practices all over the world. It is also key to explain what governance is in UNOPS. We have seen a lot of questions, comments that have been raised about how does UNOPS work, what are the control mechanisms that are in place in UNOPS. Well, UNOPS was created by the General Assembly, like I mentioned, so we have the participation of all member states. We also have a governance body, which is the Executive Board, made up of 36 member states, meaning 36 countries. Mexico is part of those members. That defines the UNOPS strategy, how UNOPS is going to work, accountability, and other types of supervision mechanisms that we have. We have other points of supervision. I cannot tell you all of them. However, one of these points is the UN Auditing Board that is made up of public servants and officers that are auditors from different countries. We take turns. So the UNOPS is subject to a control body, and we also have the financial sustainability part of this. I have also heard a lot of questions about what is the cost of UNOPS. So whenever UNOPS was created, it was created with a very particular characteristic. That means that it does not get any sort of voluntary contributions by the member states of the UN that are usually contributed every year. Well, UNOPS is an international non-profit organization that is self-financed. This is important to note. Why? Because that allows to really continue with our financial rigor and thoroughness in terms of cost recovery. Of course, running UNOPS entails a cost. However, that is run based on strictly necessary input for us to be able to manage the projects based on the time that may be required. So this is a very important piece for me. Why? Because this is the framework that is used for us to be able to understand what is the functioning and operation of UNOPS, particularly for the Mexican state. This is for a fair public management. Obviously, we know that UNOPS really fosters for the implementation of this fair public management. You may see that we have different concepts. We know that this fair public management consists of various departments, meaning efficacy and efficiency, transparency, equality, gender equality, diversity, being able to use innovation and technology, also having public officials and servants that are of excellent performance. All of that is going to allow us to put this fair public management strategy in place in order to maximize transparency and profitability of public expense. What does this mean? Well, this means that we expect to be able to do more with less resources. We know that public resources are usually very restricted, and for that reason, we expect to cause impact, savings, and obviously that is going to lead us to get more medications, just like in this case, to increase the efficiency and sustainable profitability. You may see that we have a great concept as, and this is exactly the point where we're trying to get to. So let's start getting into the merits of this subject. I'm not going to repeat what Juan has already mentioned regarding INSABI and OPS agreement. What are we going to tender for 2021? This is the information that you're all looking and waiting for. So we're going to be tendering almost 2,380 keys of medical input, medications patented from a unique source, generic medications that are prioritized through INSABI for a consolidated purchase. To the right-hand side, you're going to see a list of medications. I'm not going to read them all, but I just want to highlight that UNOPS will not procure vaccines. It is out of the scope of our service. So what is this acquisition strategy for 2021? Well, we have two phases. One of them is related to this temporary dimension. The first stage is for the supply of immediate and short-term needs, meaning for 2021. In this case, we're trying to optimize the critical supply in this context of a pandemic. We have three main domains of acquisition: international public tenders from multiple batches. We are going to request national and international competitive quotations and negotiations of patented and sole source products, and we're also going to have immediate competitive procedures for critical products. We're going to get into the details later on in a timeline. And the second phase, phase two, is obviously related to the long term. We're going to have a better planning, of course, because we are thinking about what this supply security means for 2022, 2024. We're going to develop a whole plan for all of this. But basically, what we're trying to do here is that we're trying to get a transition towards a multi-year sustainable acquisition model for us to be able to have what we call installed capacity in the Mexican state. Why? Because what UNOPS intends to do is not only to provide support in the short term, but also to set the conditions for the Mexican government to continue running in the best way possible with this acquisition process. And this acquisition strategy is basically based on what we have seen in the short term as well. And we're going to do this with a better prioritization, and we're going to see this later on in a timeline like I mentioned. So all of this information is key in my view. Why? Because I believe that we're trying to address all of the questions and comments that we have seen out there in the newspapers that are basically related to the principles of international public tenders. So these tenders are going to be conducted according to the regulations, rules, policies, and procedures that are applicable to UNOPS. These are not obscure or critical processes. These are based on the best international practices, considering the reach of UNOPS based on general regulations with the highest standards for transparency, integrity, according to what we intend to do. We intend to promote an open competition under equal conditions. I think that we call it even floor in Mexico, meaning an even floor for the Mexican and international market. So we're trying to find competitive and fair prices for quality products, security, and efficacy. We're not going to have any sort of discounts. No, we're going to just follow all protocols that are in place. However, the main purpose, of course, is to find some sort of savings for our public funds, and we're going to be able to use two tools for this. I do not know if you remember that we were looking at another image in the previous slide. we were addressing innovation and technology. Well, UNOPS, to do so, is going to use two platforms, a portal and a platform, UN Global Market, UNGM, and another platform that is an e-sourcing platform. We're going to be able to see that later on. So as you may see, we're going from the general or the overview of this tenders towards the detailed information, just for you to have the full picture. So what are the different stages of this acquisition process? First, we have conducted a market request for information. So UNOPS works worldwide, so that's why we're using all of these acronyms in English. But when I say RFI, I mean request for information. So right now we are trying to outline what are going to be the procurement requirements along with INSABI, and also we're going to get into the other stages of a regular tendering process by making a publication of the international tenders, some invitations to negotiation processes and competitive procurement, and then we're going to start evaluating the different offers and quotations that are part of a tendering process. We're going to select vendors and suppliers and to make an independent review of processes. It is important also to mention that UNOPS, as part of its framework, well, it is going to work under control of this tender process. For that reason, the recommendation when it comes to granting a project, all of that is going to be subject to a cross-sectorial contract or agreement committee. And lastly, we're going to just report and make this result information publicly available, and we're going to grant the agreements and contracts that may be awarded. So we're going to be addressing what is this request for information or RFI. Well, UNOPS also conducted it from August the 25th to September 15, 2020. This is something that UNOPS does in international and important subjects, just like this case. And that RFI is also an indicator for us to somehow tell what is going on in the market and to start really telling what is the interest out there in the market. These are very important input for us to be able to really structure our acquisition plan for this consolidated procurement. So what is the industry telling us? Well, first and foremost, that there are almost over 800 companies that showed their interest, and those 800 companies come from 48 countries that showed their interest. And a key and really important fact of this is that we saw that over 90% of our keys under our tendering points have been already fulfilled. So this is a different stage. However, this really allows us to understand how all of this is working. And I cannot really tell you all of the RFI results. I would like to give you more details. However, I can tell you that this medication keys are specifically part of this. We have a significant part, which is 800, that is healing and medical inputs. We have some other therapeutical groups that raised higher interest. These are in the upper side, and then we have medical input at the bottom side. So I was telling you also about the tools that we're going to be using. So very briefly, I would like to explain this. This is the Global Market, or UNGM. This is the official acquisition portal of the UN, not only for UNOPS, it's for the whole UN system. So that means that we're going to make all of this really transparent. We're going to make this openly. And that means that the company, let's say if a company has interest, they need to create a profile in this UNGM portal. This virtual event recording is going to be available to all of you. So in case you need to review this, well, this is the link that you need to use. We also have some medication code, whether for medication or healing material or medical input. So all of this is very important because this is part of our tender. And this is a great opportunity for Mexican and international companies. Once they have created their profile in this UNGM, then they can start taking part in this international tenders, not only held by UNOPS, but by other companies. So for that reason, I would like to invite you all to take part in this global market. So We also have uh, the whole training and information and all of that information that you can learn about this process. It is online, official, and free to all of you. So please take a look at it. You can use all of this information for you to be able to learn how to enroll and register. So this electronic platform, well, UNOPS does not use paper processes. No, at UNOPS, we're using e-sourcing. This is an electronic platform. We just submit all of the required information through this platform. We identify the source of vendors and suppliers, documentation, Q&A, opening of tenders, evaluation process, and contract awarding as well. All of this is very important because it is part of that transparency that we have been addressing, and for us to be able to give an equal opportunity to all vendors and suppliers. So all of this is very important. Now, concerning e-sourcing, well, you can learn more about this system. This is the link that you can visit in this, as I can show you in this slide. Another tool that is very valuable to us, it's an UNOPS internal tool. Juan already mentioned this. This is the Regional Observatory of Medication Price. This allows to map and monitor the price of medications in over 20 countries. This is a very powerful tool because it allows to analyze if prices are reasonable, specifically for medications, and also guiding us through a tendering process. This is very important because when really opening a tender and when negotiating patents, this is going to also get us a lot of very valuable information. So hopefully you can see this very clearly. So these are the next steps for the acquisition in 2021. We have the main milestones and the time for these milestones. So right now, we are just finishing the consolidated procurement with INSABI. We have this request of quick processes, the keys, quantities, delivery plan, place of delivery, and the budget. For that, we expect to complete this by mid-October. And later, we're going to also open this acquisition process with various invitations for generic medications with medical supplies and healing material, but also to start negotiating the patents. In November, we expect to be able to complete this patent negotiation and therefore to start executing all of these purchase agreements and just moving forward with all of these generic medications and critical supplies for healing as well. Well, as of January, our intent is to start just with this, what we call uh, delayed deliveries, let's say, on certain periods, and then to start supplying them regularly. We're going to have generic medications. We expect to complete this whole with this tendering process and with the awarding by the first quarter of 2021. And well, this is for the second phase period, and basically you can tell that these are pretty much the same processes. However, we have more time, and this also allows to have a better planning to what we have as multi-year contracts. And we also intend to have another RFI. Why? Because we also need to understand again what is the market indication, right, in the industry. And just to finish with this, I want to tell you that on behalf of UNOPS and of the United Nations system, that well, our tenders leave us to expect for us to be able to put all of these sustainable acquisitions with a gender perspective. That means that we would like to have other types of requirements for us to be able to continue with this gender approach and to ask companies to be responsible by following and using these integrity standards with a focus of sustainability to maximize economic, social, and environmental benefits. We have a drive program that we have put in place in other countries with other suppliers. They have actually thanked us for continuing with this program, and we will continue maximizing this as part of our framework for this program. And also, I would like to thank our public Thank you, Mr. Juan Ferrer, Antonio. Thank you so much for joining me today. So we have all of this information. This is the website that has been created. It is www.proyectosaludmexico.org. This is the email that we have. You can submit your information, questions, comments, anything you would like to learn. You can write to all of us. Well, you are going to see that we have a lot of virtual agencies. A lot of these questions are related to this tendering processes, and all of them, well, need to be addressed as well. Anyway, this is the information for you. So thank you so much, and I would like to pass the floor to Mrs. Erika. Thank you so much. I just wanted to tell you that that's the email that we have available. We're going to have a lot of points, and we have over 1900 points as well. We have this available, this conference in Spanish and English in YouTube. So Dr. Novello, please, we have seen throughout this presentation that medications are very important. Healing material is very important. So is there anything you would like to share with us regarding the applicable process to all of this medical registrations? Thank you everyone for joining us today, whether if you're virtually or on the side, Mr. Juan Ferrer, Mr. Giuseppe Mancinelli, Alejandro Calderon, and everyone who is in this room right now. It is such an honor for me to be taking part in this acquisition of health supplies. The Mexican government is a new government. It's a new government that is deeply concerned about human rights, with no discrimination of any type whatsoever. The current government has also conducted a series of efforts in my institution, which is the Federal Commission for the Protection Against Sanitary Risks, or COFEPRIS. And right now, what we are doing, what we're living in this international acquisition, is something just to tell you a little bit more about history. Well, it all started in part due to poor management of my institution in previous terms. So it is important to learn all of this for us to be able to go towards a brighter future in this government, for your own safety and security as tenders and vendors, all of those type of issues that we had in COFEPRIS, such as favoritism, privileges, influence, all of that is over. And I need to highlight this because this has come to an end, because if you are part of a tender, of course, we would like to make the floor even, like we said before. So, COFEPRIS, currently, please be certain that this is how we do it, under a legal framework that is non-negotiable and it cannot be modified. As per the National Development Plan 2019-2024, the federal government is now putting all of the actions in place that may be required to make sure that by 2024, all Mexicans are able to have available, as Dr. Ferrer mentioned this, to have free medical care, hospital care, including healing material, medical input medications, vaccines, at no cost. Under this context, COFEPRIS has developed a series of strategies to make sure that we can ensure what I just mentioned by publishing a resolution in 2020, by means of which any medication or medical input or health input in general that may be required, and with a sanitary risk at the country of origin, may and could be procured. And that has been our cornerstone for this consolidated procurement that has enabled the federal government through UNOPS to plan consolidated procurement of medications that we intend to do here through an inclusive mechanism that can enable saving high amounts of financial capital through this mechanism. the different powers of the Secretariat of Health, such as INSABI, the Mexican Social Security Institute, SEDEMA, or the Department of Defense, and the Social Security for state workers, and through other agencies just like UNOPS, are going to take the actions for us to be able to take and supply all of these medications and medical input towards the whole health system in Mexico. It is very important, it is a cornerstone, in fact, that these supplies have a sanitary registration at the country of origin. Having a recognition or authorization by regulatory authorities such as Switzerland or the European Union, US, Canada, Australia, and other regulatory agencies that are the benchmark that have been pre-qualified by the pre-qualification program for medications and vaccines of the WHO. Some regulatory agencies that are members of this cooperation agency, or PICS. If a product has been already blacklisted by the WHO or by some sort of regulatory agency recognized by PAHO and WHO and other regulatory agents that are members of PICS, when this safety profile is not favorable in that case. So we know that the heads of those agencies and legal representatives who have obtained this sanitary registration must meet all of the requirements under the law for them to continue just obtaining the renewal of their authorization, for them to be able to continue selling their products in the Mexican territory according to the applicable provisions. Expiration date of over 12 months, starting on the date when the medication entered the country, except in those cases when we are talking about those medications that, because of their own nature, have some sort of diminished stability as per the input regulations that we have. These documents must be drafted in Spanish. Otherwise, this must be accompanied by a translation into Spanish certified by the health agency. All of the documentation issued by the authorities of other countries must come accompanied with their apostille and also certified by expert translators before the Mexican courts. And also, I would like to mention that I'm not going to read the contents of this document as a whole, because this document is publicly available to all participants in the tender at COFEPRIS website, and also through INSABI's website and UNOPS website. But we have 5 modules that are administrative, legal, sanitary permits or licenses. Module 2 is related to quality summaries, clinical and non-clinical data that may be available in modules 3, 4, and 5, related to quality, non-clinical evidence, clinical evidence as well. COFEPRIS accompanies all of the units that have been authorized to work with input. It also checks the quality, safety, efficiency, identity through samples in the laboratory, analytical laboratory, through some batch by batch, through section 43 of the regulations to inputs and according to standard 059. And also, we will have the distribution and storage of health inputs. And lastly, well, not lastly, last but not least, that's what I meant, we will also have this pharmacovigilance through our own institution, pharmacovigilance that did not exist in the past, and it has been already rescued through this fourth transformation government. Thank you so much for your kind attention. Thank you so much, Dr. Robledo. Your whole presentation with the links and everything is going to be available in various channels. First and foremost, the presentation that we are just addressing right now is going to be available also in YouTube. We're going to be uploading everything in our website that we have developed for this proyectosaludmexico.org. Once again, we would like to invite you all to submit your questions, your comments, just general specific questions to adquisiciones.mexico at unops.org. Once again, thank you so much, everyone. Thank you, everyone, to our panel members. We are all together in the UN through UNOPS, COFEPRIS, INSABI, the Mexican government, and we also have some chambers and representatives from the Mexican market, the international market, the media, some civil society organizations. Thank you everyone for taking part. Today, well, we're having the first of many, many other sessions that we're going to be having. Hopefully, we do have your participation through other channels that we're still opening. Thank you so much, everyone. Good afternoon, good evening. It all depends on where you are. Thank you so much for attending this meeting.